Congresswoman Katie Porter. I represent California's 45th Congressional District, and I want to talk with you today about navigating health insurance. Even in the best of times, that is a difficult process and can be confusing. And right now, millions of Americans and Californians are facing unemployment, causing us to grapple with questions about how to stay insured during this time. And as your representative, I believe it's my responsibility to help get you information and keep you informed. And that's why I'm here today with Dr. Shana Charles. Dr. Charles is an assistant professor in the Department of Public Health at Cal State Fullerton. She worked as the Director of Health Insurance Studies and spent 9 years as Senior Research Associate at the UCLA Center for Health Policy Research. She's also an active member of the California Health Benefits Review Program, Faculty Task Force, which analyzes the effects of proposed health insurance benefit mandates on behalf of the California legislature. Every American needs and deserves access to quality, affordable health, and this is more than ever during this public health crisis. As a lifelong consumer advocate, I know how important it is that you clear and accurate information to help you make the best financial decision for your family. I encourage you to explore your options for healthcare coverage, to reach out to our office or to Covered California, the state's healthcare exchange, with any questions you may still have after today's conversation. So with that, I'll turn it over to Dr. Charles.
Hi, thanks for having me.
Excellent. So I think we're going to start by taking some questions and answers. And so the first question that I have is, in healthcare, there are so many terms and acronyms. And so I find it very confusing to try to navigate. And so one acronym I've been seeing recently is SEP, S-E-P, which I thought stood for self-employment pension, but it has a totally different meaning in the healthcare context. So can you tell us, what is a SEP? What is it, S-E-P? What does it stand for, and what does it mean for people? When did it start? When does it end?
Okay, so this is something that is part of Covered California, and it has to do with enrollment. So it's special enrollment period. And usually in normal times, this is something that would only relate to people who had some kind of life change, a life crisis that then enabled them to become newly eligible. But now we're all facing this crisis. We're all having this big change all at once. And so Covered California has opened up completely and has extended a full special enrollment period now all the way to June 30th for this year, so for 2020. So for those people who did not sign up for health insurance in January and February, you can now, which you weren't able to do before. And for people who are finding themselves newly unemployed or are having other kinds of life situation changes, they can also go to Covered California and potentially sign up now. And that would be for the private coverage. I want to point out that Medi-Cal, which you can also access through Covered California, is always open all year round. So that's important too. You can always apply for that even after June 30th's set period is over.
With regard to the SEP period, traditionally we're told that we can change our healthcare only if we have a qualifying life event. And so I know this includes things like getting divorced, the loss or death of a spouse. How does qualifying life event connect to the special enrollment period? And how can you talk about what kinds of qualifying life events might relate to people who have lost their jobs? Or what if you've just lost your hours? What if you've been furloughed but are told you are coming back? Are those qualifying life events?
Yeah, Covered California is taking a much broader view now. So that should be a possibility. And really, one of the things that has to happen first is connecting with them. So you mentioned earlier going to coveredca.com. The navigators who are trained on that website and the people who contact you from that website, they will know all of the different events that happen. Certainly, losing your hours might make you eligible if you also are uninsured. If you still have health insurance through your job, you might not be eligible. You would have to keep that insurance through your job first. So it really depends on the individual situation. And also, I mean, I hate to say it, but we're recording this today, which is, April 21st, and it's possible that 2 days from now, a new regulation might be issued because the experience is just changing so fast right now in California, and they're coming out with new issues.
You're exactly right. And we're working at the federal level to try to provide additional resources to states. And then that's helping the state then provide more coverage to more people at a lower cost. So it's an ongoing thing. So I really want to echo what she said about going to coveredcalifornia.com and making use of the navigators on there. You are not alone in trying to figure this out, and you shouldn't be alone. So when you go to that site, there's free help for you. And so it's really important to take advantage of those free resources.
And that they're free is very important. A lot of people think they have to pay a private broker, they have to pay somebody to do this for them. The navigators are not allowed to charge you. So if somebody says that you have to pay them for this, they're not being accurate, to say the least.
Yep. So let's watch out for scams or frauds during this time, because anytime we know that there's a great need, we'll see people who try to take advantage. So I'm sorry about the person who just walked through my recorded video. I also have a fly that is circling in front of my face. So we are all doing the best we can in challenging circumstances right now. I wanted to ask you about what constituents should be doing if they've had their pay decreased. I mean, a lot of people are hesitant to go to Covered California because they know that even though they can get insurance, they can't afford insurance. And so for me, I always focus on what really can people get in their lives, not just what their rights are. And so can you talk a little bit about the qualification for financial aid?
Okay, so the way Covered California works is they look at your household size, and then they look at your estimated income. Now, there's been some anxiety about this estimate. People think it's like, okay, once I tell them this number, it's set in stone, and what if it changes? It's okay if it changes. It's supposed to be just an estimate, and of course, you might have had a recent drop in your income, and it's possible that that might continue for the year. So estimate that your income is going to be that lower level, and that will get you the most help that you can get. Now, what happens if a good thing happens and you get more income and you actually are able to maybe afford more? Then you do need to tell them that, because with that estimate, you'll have to tell them next year on your taxes what your income actually was, and then you would have to go back and refund. You'd have to pay back subsidies if you didn't actually qualify for them. So that's something that can happen down the road, but there's no penalty for any of those things. So it's perfectly fine to estimate the lowest kind of worst case scenario that you're looking at right now, and you can get help at that level.
Excellent. So keep Covered California informed as your income goes up or down, but it's okay to you should make the application based on the income you have right now.
Yes.
Available to pay your premium.
Exactly. And if you're in a bad situation right now, definitely let them know that. And the way that it works is that there's a flat level depending on different factors like age and household size. Under that level, you get offered Medi-Cal, and that is a free program. People who haven't used it before sometimes worry that it's going to be a bad program, but I will tell you that the studies have shown, and I've been doing these studies for almost 20 years now, that people who have Medi-Cal find it to be almost as good as job-based coverage in terms of accessing doctors, in terms of being able to get the care they need. Their main problems usually have to do with other problems like transportation and things kind of outside the Medi-Cal program's purview. But Medi-Cal is free. It's no cost to people. If you get put into that program, you're not even going to pay premiums. You're not going to pay any co-pays. And then let's say you're kind of just over that Medi-Cal budget. Let's say you're close to it. Well, then Covered California actually has phased in help, so that if you're kind of close to Medi-Cal, but you just don't qualify, your premium's still going to be really low. With those subsidies, I've seen people have monthly premiums as low as $2 a month. I'm not kidding. It can really subsidize you. And it can also subsidize your deductibles. It can subsidize your co-pays if you're down near that level. So make sure to tell them, what the real situation is that you're facing, what you're estimating as your worst case scenario. And then, if things get better for you, and that would be wonderful if it did, then you can go back and tell them, hey, I have this income now, and they can adjust your subsidies based on that.
So I have a question from a constituent about this. So say that last year your income, or even through January and February, your income was, say, $100,000. You would be able to purchase on the exchange, but you would be paying the full premium. But as of March 1, your income has been zero and you have no immediate prospect of that changing. Are you potentially eligible for Medi-Cal, or how much of a look back is there today?
It's the calendar year 2020, and you can take into account, this is what my monthly income was January and February, here's what it is now, and here's what it is looking forward, and put all those things together for that annual estimate. The other thing I'd like to mention here is that based on your household income and your family size, you might actually qualify for help with $100,000 of a household income these days. California put in more help last year. And so individuals up to $75,000 a year can qualify for some help, and families of four up to $154,000 a year still qualify for some help. So there's more money in there to be able to help people afford to get covered.
That's really helpful, because I think a lot of people assume that they're not eligible for these programs and then they don't apply. And so it's really important to, if you don't have insurance today, if you're worried about your insurance, you've lost coverage, it's important to go and check out what you might be eligible for, because it, like you said, it may be different than it has been in the past, because we're trying to expand these programs, and we want to make sure that everyone tries to get coverage right now. So I appreciate your mentioning that. I wanted to ask a question from a constituent in Irvine about the expense of COBRA plans, and how that's going to intersect with small businesses. So she says small business employers should be able, this is her idea, should be able to use the money that they got through the CARES Act, say through the Paycheck Protection Program or the Economic Injury Disaster Loan, to cover their furloughed without pay employer portion. So this is more of a federal law question. So I want to take this one and then see if you have anything to add. So Congress did pass these programs to help small businesses, and the programs can be used for the payment of group healthcare benefits, including insurance premiums. The idea, however, was that people would stay on the payroll, and therefore stay connected to their benefits. So if the small business you were working for receives money through the Paycheck Protection Program, then 75% of those funds need to be going to the cost of payroll, including the cost of health insurance benefits. So your small business owner is also doing the best they can to learn about these programs, to apply for these programs, to figure out how they're going to administer that money. So stay in touch with your employer if you've been furloughed or laid off, to see, because a lot of these small business owners, I hear this from them every day, they want to get these resources from the federal government so that they can begin paying their employees, even if those employees are having to stay home or work reduced hours right now. So Congress is also looking at trying to add more funding this week to those small business programs. And we're also having ongoing discussions about whether or not there's a way for Congress to help families meet the cost of COBRA premiums, which can be very high. And so before you sign up for COBRA, one important thing to do is to go on to Covered California and see what the cost of insurance might be on the exchange. You may be able to get coverage cheaper through the exchange than through COBRA, and that navigator can help you assess that. Dr. Charles, anything to add to that?
Yeah, I would say just to mention here that there's this shop and compare button on the front page of the Covered California website. And what that is good for is that you can kind of just put in the basic outlines of your situation, and it's going to show you what you might be eligible for, and you can look at it without having to go through a full application. So if you just kind of want to look at your options and see, maybe you're thinking COBRA, maybe you're thinking Covered California, this is a way to check that out without having to go through the full application process.
Excellent. So people can kind of get a sense of it, of what might be possible without having to fully apply.
Exactly.
Excellent. Do you have any advice for the small business owners themselves? I mean, I spend a lot of my time talking to them, trying to help them. Is there anything they should be thinking about right now about how to support their employees?
Yeah, I've been thinking about this question a lot. And honestly, as an academic, I've never been a small business owner, so I don't know what those pressures are like. I do know, as someone who has a lot of people asking me questions, I have found it to be kind of my responsibility to stay as informed as possible, as much as it's difficult to really keep up with the news every day and to keep up with what's going on the legal aspects and the new laws that are coming out on a weekly basis, to be that resource. And I would say for small business owners, I know it's hard, but please try to be as informed as possible. Stay in touch with policymakers like yourselves, which is great that you're making yourself so available, and other people at the local level and at the state level, so that they can be a resource for their employees instead of a source of confusion and frustration for their employees. I think if we all treat this as we all need to try and make these programs work as well as possible, and we're all learning as we go, hopefully that can help get us all through.
Yeah, and I think it's hard for many of these small business owners who pride themselves on never having to let an employee go, on being a terrific employer. They don't want to deliver sometimes hard news about things. So I think it's important for small business owners to also learn about what options are available to their employees through Covered California. And so if you are having to deliver the hard news that someone's going to be laid off and you're not going to be able to pay their benefits, make sure you're giving them information to connect them to options like Covered California, which I think is really going to help people right now be able to do that. One of the questions I have is about, we have an unprecedented number of people who are filing for unemployment right now. And again, many of them are very, very new to this process. So some people have applied. I have a question from someone who said, I've applied for unemployment benefits and they completed the secondary form, and they were instructed not to mail it back until April 12th. So this was a little bit a while ago that we got this question. She said, I have investigated Covered California health insurance, but that requires me to estimate my total 2020 income before I apply. Since I haven't actually gotten approved for any unemployment benefits, she believes she cannot apply for Covered California health insurance. Can you help explain what someone should do? Because we are hearing that it's taking sometimes 2, 3, and 4 weeks for people to get through the California unemployment system, even though the governor has reallocated 1,200 workers to supplement the state unemployment system. And we also have a lot of small, like solo entrepreneurs who are waiting. The federal government expanded unemployment insurance to cover self-employed people, but
Right.
That portal won't be up and running with the state until April 28th. So what should someone do if they're in that situation where they're not yet through the unemployment process?
Yeah, I think this is a situation where they need to understand that Covered California's estimation of annual income is not the same as this is the legal document that you're putting in for your unemployment insurance. This is your taxes, right? Those numbers are hard and fast numbers and you should not be changing them. The Covered California estimate of your income is there to be flexible about changes. And even on the front page, they've put a button now, a new button that says, has your income changed due to COVID-19? Let us know. So they understand at Covered California that people's income will change, that everyone's going through the ups and downs right now. When it comes to unemployment insurance, my understanding is that that income is not income that is counted on your forms, but that's something the navigators can answer more fully for particular situations. And I think it's really important for people to not let themselves get tied into knots being worried about that yearly estimate. Let them know how bad things are now. You can make that your annual income, keeping into mind what you did in January and February and put those together. And then when things get better for you, and hopefully they will very soon, but you never know. But when things get better, that's when you can inform Covered California and go back. And it is possible to get those subsidies adjusted. And if necessary, you might, when you're in a better situation, when you have more income, be able to refund a subsidy that you didn't need, you ended up not needing. But it's better to let them know how bad it is now and get that subsidy, which is an immediate credit. It's not something that's put off. It is something that's taken off your premiums right now. And then if the worst happens and that continues to be your situation for the year, then you're ongoing with that.
Yeah. So like you said, if your income goes up or goes down, keep Covered California up to date about that. So even for people who are watching who may have insurance through the exchange already, if your income has significantly gone down, there's that button you mentioned to let them know. And then when you get back on your feet or you get that employer-sponsored coverage, don't forget to let Covered California know that your situation has improved, which is what we're all hoping to see happen. So
exactly. I mean, I think that's a good point about people maybe not even who have subsidies right now. Maybe that subsidy isn't enough to reflect your current situation, and don't feel like you're trapped in that, you know, income that you gave them from last year's taxes. You can go in and adjust your income and let them know things have gotten worse for you. Definitely.
Great. One of the things that I often hear and that is a big concern for me is not just getting people insurance, but getting people insurance that they can afford to use. And that's not just about paying the premium, that's about paying for the deductible and the out-of-pocket maximum and some of those things. So what about people who are worried that right now in a zero income situation, they wouldn't be able to pay? Maybe they still have their benefits. Maybe they are, you know, they paid for them through COBRA, but if they ever had to go to the doctor, they wouldn't have that $1,000, $800, whatever it is deductible. Do you have any suggestions for how those people should navigate in this situation?
Yeah, there's a few things. The first one is, you know, if you already have that COBRA insurance, let's say you already have that coverage and you have that relationship through an insurance company, they might be able to work with you for these 3 months or so. There is a situation even where you could not pay your premium and they would still pay your claims for that first month. But it's good to let them know and to have that conversation. If you have a Covered California plan that has a higher deductible, let's say, because some of these plans are pretty high deductible. They go up to $6,300 a year for a family sometimes. You would also let Covered California know, because it's possible that you would get more of a subsidy and that deductible would be eliminated. So when I was talking before about those people who are kind of right above that Medi-Cal eligibility, part of what they get as benefits in there is reductions in their copays, reductions in their deductibles, also along with premium support. It's called the—
So it's not just cheaper premiums, it can actually be less expensive care.
Exactly. And it's called the enhanced silver option. It's a little bit of a complicated name, but that's what it relates to. So that option might be available for you if you're in that situation, or if your income's really gone all the way down, you might then qualify for the no-cost Medi-Cal. Which is—
And I just want to, as we wrap up here, mention that and echo what Dr. Charles said at the beginning about that the quality of care and the number of providers that are available to you under Medi-Cal is actually very high. So most of our major healthcare providers here in Orange County do take Medi-Cal and are very familiar and very comfortable with that program. So most people shouldn't be worried, routine physical care anyway, about gaps with Medi-Cal. A lot of people will find, you know, call your doctor and ask, but I think a lot of people will find that their providers already take Medi-Cal and that they'll be able to continue with their same provider.
Yeah, and I want to point out, in Orange County specifically, it's called Cal Optima. So if you see Cal Optima, that is Medi-Cal here. We have one plan that everybody's on, and that's how the county just organizes and arranges it. And honestly, it is a really well-managed plan. Cal Optima is an example of a really great county-operated health system. Not to say that it's perfect, because nothing's ever perfect. And one other thing I wanted to mention also is that COVID-19, you know, is causing specific expenses. The testing, you know, the screening for that. The Orange County Healthcare Agency just announced that there are options for free testing for people who don't get that test through their doctor. But I do want to point out that if you are insured, all of that testing is covered. And Congresswoman, this was something that you got the CDC director. That was such a wonderful moment when you really pushed for that. And it also was in the law. And but if you're not insured, then people are starting to get charged for these tests. We're seeing some reports of that, people who've gone in. So having coverage of any kind is better than not having coverage. And so and it can be retroactive.
As you point out, may go in and you may test positive. You may not test positive for COVID-19, but you may test positive for the flu, and you may need health care. And so we want, very much people not just to get tested, but to be able to get any available treatment to assist them with recovering. And so I encourage everybody to do what they can to maintain insurance coverage, take advantage of federal government working in partnership with the state government through Covered California, through Medi-Cal, which thank you for pointing out, because people will sometimes tell me, I don't have Medi-Cal, I have Cal Optima. But
Right.
Cal Optima is the Orange County sort of brand name of the statewide Medi-Cal program. So my office has together a frequently asked questions that is available on our website, porter.house.gov, and that answers to many of the questions that we've covered today in written form. We're available to continue to help you answer questions. We're going to continue to put out guides, continue to do videos like this to help families get the information that they need. I just want to say, Dr. Charles, thank you so much for volunteering to serve our community right now, to be here to answer these questions, and for being a resource to our community. It is scary to face the loss of health insurance, and it's a scary thing for a lot of people. And so appreciate you echoing to people that there are options that they should take advantage of now, and it's important to use these options. And so thank you very much for walking us through what can be a confusing and difficult process.
Yeah, absolutely. Thanks for having me. And I do just want to point out, I'm local here at Cal State Fullerton, and please feel free to reach out to me if you need to at scharles@fullerton.edu. Also your local congressperson is an excellent resource, as well as the state assembly members or even your local city council folks. Everybody in Orange County is working together to try and beat this thing. So stay safe, everybody.
Yep. Absolutely, stay safe. And let me just give the Covered California website one more time, which you already gave. It is www.coveredca.com. And even though that's a .com, that is the state of California's official healthcare exchange. So coveredca.com, and their 1-800 number for their service center is 800-300-1506. So if you don't have internet access and aren't able to use it that way, you can also call. And they do also have some language assistance and things like that. Make use of the navigators to get help. So thank you, everyone. We used to always say, I hope to see you soon. Now stay home and stay safe. Thank you.
Thank you.